let's catch up on the latest when it comes to the vaccine rollout. Now, I want to go again to Melbourne and talk to Dr. Stacey Harris, a Melbourne GP we've caught up with before. Good to talk to you, Stacey. First up, what's the demand you're getting for vaccines in your surgery? What sort of resistance are you getting to people from accepting the AstraZeneca vaccine?
Oh, it's very polar opposites. We're getting lots of people keen, but we're also getting lots of people afraid. And so people are getting the mixed messages from media and from lack of, I guess, media about the vaccine. So, yeah, there's just lots of hesitancy going on, especially once all this came out with the clots, which is disappointing because you mentioned in your previous talk there about trusting medical science, and that's just it. This is medical science, and people are mistrusting of it. And sadly, we're not moving on. We're stuck in this rut of no one's moving anywhere because no one's willing to, or not no one, but less people are willing to have this vaccine because of fear.
A lot of the alarmism we've seen directed at the virus from the media and politicians has also been directed at the blood clotting issue.
Oh, definitely. I mean, you would remember the AIDS campaign back in the 80s. I mean, how successful was that in educating people? And I feel there's not enough out there to actually explain, that the risks are very, very, very low with the vaccine. And, just go and have it, because the longer you wait, I've had patients say to me they're just waiting. And what are people waiting for? We know the risks are there, but are very extremely low, lower than the background risk of just clots occurring every day anyway. So what are we waiting for? It's 12 weeks apart, the AstraZeneca. Have it now. We are facing winter. And, just reduce the risk of passing it on and decreasing the risk of death and complications to yourself.
I'll give you a chance to convince me in just a second, but first up, is the difference in approach correlating to age? I mean, I would have thought anyone over 70, they're going to be a no-brainer, give me AstraZeneca, but if they're people in their 50s, maybe very healthy in their early 60s, they might not be so keen on the risk?
Look, I get that, and I think that the over 70s are more keen to get it because I think they're more worried, of course, of, the risk of dying. But as I say to patients, even over 50, this infection is not going away. It just takes one person to leak this out, and we've already seen it. Our hotel quarantining is probably better than it was last year, but having said that, it's going to leak out. It's going to come. We are already seeing it, and just be covered because ultimately, we want to reduce.
Stacey, convince me. I'm the classic case, right? It might surprise you looking at me, but I am well over 50. But I'm reasonably healthy. And with the way we've virtually eliminated this virus, I feel that there's almost zero risk of me picking up the virus around Sydney at the moment. And I know there's a tiny risk with AstraZeneca, but it is a tiny risk. So I feel, I'm not an anti-vaxxer. I think I'll get vaccinated at some stage, but I just feel no sense of urgency whatsoever. How can you convince me that I should be making an appointment now?
I totally agree in that. Yeah, the risks of getting COVID at the moment are low, and we have these measures. We are safe in Australia. But if we haven't eradicated it, it's still coming through our airports. We're still seeing it, so we're not. Still, the risk of getting it, yes, is low, but then the risk of you getting it and suffering from blood clots from COVID or even complications are higher than your risks of getting clots from the vaccine. So I sort of say to my patients, your risk of clots might be here from the actual infection. Your risks of clots from the vaccine are very low. So I'd take the lower risk of the vaccine and just be vaccinated, just be covered from this horrible thing.
And the question is, if we knew there was an outbreak running rampant in our suburb, would we rush off and get the vaccine then? I think most of us would say yes. So why not get in ahead? I
have no doubt. I have no doubt. We're not India. We're not other countries that are suffering so badly from it, and so therefore everyone thinks we're safe. And mostly we are. I guess that's the thing, and that's what's difficult is that. But I still encourage and urge everyone over 50, please go have it. In fact, it should be even less than that. We should be vaccinating everyone, but at the moment it's over 50. So, yeah.
Great, Stacey. I appreciate it.
Yeah, thank you.
Stacey Harris there, Dr. Stacey Harris, a GP from Melbourne. And maybe I'll make an appointment. I'll keep you up to date. But we've all got to wrestle with this, and I think we're all going to have to get ourselves vaccinated at some stage.